Most people go to the bathroom every day and never really look down, and that is understandable because no one wants to think much about it. But today, I need you to pause for a second and pay attention. Because your urine, the thing you ignore every single day, may be one of the clearest warning signs your body is sending you. It does not always scream for attention. Sometimes it changes in very small ways: a darker color, a different smell, or maybe you are getting up more at night than you used to. Those things sound minor. And that is exactly why they can be dangerous. A lot of people between 55 and 70 are living with serious health problems like early kidney disease, advancing diabetes, or even signs of bladder cancer. And they do not know it because they have never paid attention to something they pass every day. Doctors call these silent warnings because they can show up in your urine long before you feel pain or start to feel truly sick. In this video, I am going to walk you through the signs you need to know. Some of them you may notice today, just by paying attention the next time you go to the bathroom. And I want you to understand this clearly. Catching these changes early is not about fear. It is about giving yourself time to do something before it is too late. Dark yellow urine and dehydration in older adults. Let's start with the most basic sign of all: color. What does healthy urine look like? The answer is pale yellow, almost like wheat, not too dark and not too clear. If you are seeing that most days, that is a good sign. But if your urine keeps turning dark yellow, almost like honey or orange, that is the first thing you should pay attention to. What many people do not know is that by the time you reach your 50s, 60s, or older, your sense of thirst is not as sharp as it used to be. In fact, studies show that older adults are often mildly dehydrated without feeling thirsty, and that makes the kidneys work much harder. Your kidneys filter about 200 quarts of blood every single day. When you do not drink enough, waste becomes more concentrated, urine gets darker, and the pressure on your kidneys goes up day after day. So how much is enough? For most adults over 55, about 6 to 8 glasses of water a day is a basic starting point, which is around 48 to 64 ounces. But if you are taking blood pressure medicine or a diuretic, that number may be different. Here is the more worrying part. Long-term dehydration in older adults does not just stress the kidneys, it also raises the risk of kidney stones and repeated urinary tract infections. And we will talk about that next, because urinary tract infections in older adults can be much more dangerous than most people realize. Orange or brown urine. Now, let's talk about the kind of change that should really get your attention. If you walk into the bathroom one morning and see urine that is dark orange, or even the color of tea or cola, that is not just a matter of drinking less water. Dark orange urine, especially when paired with pale stools, can be a classic warning sign that something is wrong with the liver, especially a bile duct blockage or hepatitis. When bile is not moving the way it should, bilirubin can leak into the blood and then into the urine, changing its color. And if you are not paying attention to your stools, this is the time to start. When those two signs show up together, your body may be sending a serious message. Dark brown urine, the color of cola, is even more concerning. It can happen after very intense exercise, especially exercise that is not a good match for your age or current condition, because injured muscle can release a protein called myoglobin into the blood, and this can damage the kidneys. This does not just happen to athletes. It can happen to anyone in their 60s who suddenly lifts something heavy, climbs a lot of stairs, or spends hours doing yard work in hot weather. This is the part I need you to remember. If the color of your urine changes suddenly and does not return to normal after drinking more water within a day, call your doctor. Do not wait. Blood in urine, a sign many people ignore. Now we get to the one sign I want you to take seriously right away. If your urine looks pink, light red, or you see red streaks in the toilet, the first thing many people think is, "I ate beets yesterday." Or, "This is probably nothing." And sometimes, that is true, because beets can temporarily turn urine pink or red. But if you have not eaten anything red in the last day or two and the color is still there, this is one of the symptoms that should lead to a doctor visit right away. Blood in the urine, called hematuria, can be a sign of a urinary tract infection, kidney stones, an enlarged prostate in men, or in more serious cases, bladder cancer or kidney cancer. What makes this especially worrying is that bladder cancer often does not cause pain in the early stage. You might see blood in your urine once, then it disappears, and you think everything is fine. But cancer does not go away just because the symptom stops showing up. According to the American Cancer Society, bladder cancer is more common in people over 55, and about 80% of cases are first noticed because of blood in the urine without pain. That is exactly why paying attention to your urine color matters so much. Nobody wants to go to the doctor over something they hope is nothing. But ignoring this symptom is one of the most expensive mistakes older adults can make. Cloudy and foamy urine, and what it can mean for your kidneys. Let's move to two signs that are often overlooked because they look so ordinary: cloudy urine and foamy urine. Many people see urine that looks cloudy or has sediment and assume they just did not drink enough water. But that is not always the reason. Cloudy urine is a common sign of a urinary tract infection. In women after menopause, UTIs happen more often because of hormone changes, and what makes them dangerous is that in older adults they do not always come with the classic burning or pain that younger people expect. Instead, they may show up as sudden confusion, unusual tiredness, or just a general feeling that something is wrong. If left untreated, a UTI in an older adult can spread to the kidneys or even lead to sepsis, which is a life-threatening condition. Now, what about foamy urine? A few bubbles that disappear quickly are usually not a problem, but if you are seeing a lot of small bubbles that stay for several minutes, that may mean protein is leaking into the urine. This is called proteinuria, and it is one of the earliest signs of chronic kidney disease, especially in people with diabetes or high blood pressure. The CDC says about 1 in 3 adults with diabetes will develop chronic kidney disease, and many do not know it until the kidneys have already lost 60 to 70% of their function. The reason is simple. Kidneys do not usually hurt when they are being damaged. They quietly work less well every day, and protein leaking into the urine is one of the earliest signs that can be detected. If you are reading this and remembering that your urine has looked foamy lately, I want you to keep that in mind, because the next part is directly connected to it. Waking up to urinate at night is not always just age. There is one thing a lot of people in their 60s think is completely normal: waking up 2 or 3 times a night to use the bathroom. And I want to say this clearly. No, that is not just a normal part of aging, even though many people think it is. Of course, as you get older, your bladder does lose some flexibility and some of its ability to hold urine. But if you are waking up 2 or more times every night on a regular basis, and this is especially true for men over 60, it can be a sign of benign prostate enlargement or, in some cases, early prostate cancer. In women, a similar pattern can be linked to weakening pelvic floor muscles or an overactive bladder. But here is what matters most. If you are waking up at night more often and also urinating a lot during the day, with small amounts each time and a strong sudden urge to go, your kidneys or bladder may be trying to tell you something. This is where many people miss the bigger picture. Frequent urination, especially at night, along with unusual thirst and urine that looks very pale, can sometimes be an early sign of type 2 diabetes that has not yet been diagnosed. Your kidneys are trying to filter extra sugar out of the blood, and that process pulls more water with it, which makes you urinate more and feel more thirsty. If you notice this pattern in yourself or someone you love, do not wait for the next routine checkup. Call a doctor sooner. What the smell of urine can reveal. I know this part can feel a little uncomfortable, but the smell of urine is also an important clue, and I cannot leave it out. Healthy urine has a light smell. It should not be strong or unpleasant. If your urine has a sweet smell, almost like fruit, that is a warning sign. A sweet smell can happen when blood sugar is too high and sugar starts passing through the kidneys. This is a symptom linked to poorly controlled type 2 diabetes and can also point to a more dangerous condition called diabetic ketoacidosis. On the other hand, if your urine smells much more like ammonia than usual, that often suggests dehydration or a urinary tract infection. And if it smells fishy or has a strange chemical odor that you cannot explain by food or medicine, that should also be discussed with a doctor. The body does not usually create unusual smells for no reason. That is one of the simplest rules to remember, and one of the easiest to ignore. What is normal in frequency and volume? Beyond color and smell, how often you urinate and how much comes out each time can tell you a lot too. For a healthy adult, urinating about 4 to 8 times a day is usually normal, depending on how much water you drink. If you are going more often than that without drinking extra fluids, or suddenly going less often than usual and feeling pressure or fullness in your lower abdomen, Those are changes that need attention. One especially concerning situation is when you suddenly cannot urinate or only pass a very small amount even though you are drinking normally. This can be a sign of a urinary blockage, most often from an enlarged prostate in men, or in more serious cases, kidney failure. Healthy kidneys make about 1 to 2 quarts of urine a day. When that number drops suddenly, it can be a medical emergency. On the other hand, urinating too much, more than 3 quarts a day without a clear reason, can be linked to diabetes insipidus, a less common but serious disorder that affects how the kidneys handle water. What I want you to understand is that none of these changes should be brushed off as just aging. Every change has a reason, and sometimes that reason matters more than people think. Medications and common misunderstandings. Before we finish, there is one more thing you need to know. Many common medicines that people over 55 take every day can change the color of urine in ways that look like disease. For example, some blood pressure medications, NSAIDs like ibuprofen or naproxen, and even certain B vitamins, can turn urine yellow, orange, or even light green. That does not mean you should ignore the change. It means that when you notice an unusual color, you should remember whether you started a new medicine or supplement in the last few days. If you did, read the side effects or ask a pharmacist. If there is no clear explanation, call your doctor. What matters here is that NSAIDs, the kind of pain medicine so many older adults use for joint pain, can actually damage the kidneys over time if used too often. And very often, the first sign you may notice is not back pain or belly pain, but a change in your urine. That is one of the reasons I want you to build the habit of noticing, just a few seconds a day, enough to catch a change before it becomes something bigger. Final advice from the doctor. I want to end with this. Your body talks to you every day. Not always with big pain or dramatic symptoms, but often with small changes that no one ever teaches you how to notice. Urine is one of the most honest signs your body gives you, because it reflects what is happening with your kidneys, your liver, your bladder, and even your blood sugar. I do not want you to walk away from this video feeling scared. I want you to walk away paying attention. Starting tomorrow, take 3 seconds before you flush. Is the color okay? Is there foam? Does anything look different? That is all, just 3 seconds a day. And if you notice anything we talked about today, dark orange urine that does not make sense, blood or pink color not related to food, foam that keeps coming back, a sweet smell that does not belong there, or a sudden change in how often you go, call your doctor, not because something is definitely wrong, but because if something is wrong, catching it early makes everything easier. Health is not built by one huge decision. It is built by small habits repeated every day. And sometimes, that small habit is simply looking down before you flush. You can start that today.